Hey everybody, Dave Whitmarsh, CEO of Whitmarsh Consulting Group, doing a new session for the Benefit Education Collective. And I learned something about our speaker just a few minutes ago. So Don Hutson, who is the CMO at a company called BCI, which stands for Benefit Claims Intelligence, has a previous career of being a professional speaker in the Hall of Fame, 16 books, New York Times bestseller, and looking forward to hearing him talk benefits. So welcome, Don.
Thank you very much, David. I'm glad to be with you today. Yeah, I was in the speaking business for decades. The pandemic kind of put a stake through the heart of that business because nobody was having meetings anymore. And that's when Mike Robinson asked me to join him and be a co-founder of Benefits Claims Intelligence about 3 years ago. So we've made great strides since then.
Perfect. And so we didn't do a dry run or anything. So did you want to tell us a bit about the company, or is it in your PowerPoint?
It's all pretty much in the PowerPoint. I'll give you this history. We put together about 14 guys, funded the organization, and our first goal was let's create software. So we found a rocket scientist in claims data, and he and his team put together our software. It took about 2 years, and now its efficacy is proven, and we have revenues. We're rocking and rolling, and we're having a good time, and we're helping the people. So it's all working very well.
Perfect. Well, feel free to share your screen and away we go.
All righty, we got a PowerPoint put together for you. There we go. I trust you can see that okay, can't you, David?
Yeah, I see everything perfect. So
excellent. Well, the title is It's Time for Integrity in Healthcare. That goes without saying, but there's a gross lack of integrity on so many fronts. And I don't want to come across as holier than thou today. Everybody's imperfect, I'm sure, but if the intent is honorable, some great things can happen in this space. And when the intent is not honorable, there's some people who are taking advantage of others. And our software has the capability to identify fraud, waste, and abuse in healthcare plans that are self-insured. And we can do this, David, with great specificity. We of course have information that identifies providers, modifiers, details, categories, and I'll cover some of that in this PowerPoint today. But we know we have some competition out there. Frankly, we haven't found anybody who's got software that can match ours. We're very proud of what we've put together in that regard. I did hear of a state-funded plan that basically paid $400,000 to an audit firm and got back a report that was absolutely lame. It was almost embarrassing. We had occasion to review the report, and the depth and capability of a software company is what's critical in terms of what we can really, what kind of end product we can produce in our research and our auditing efforts. And we feel very good about those capabilities. So basically where we are today is in terms of seeking integrity on the part of everybody who's in the loop on your healthcare plan. And I know we have employers on today, we have some brokers on, and we've got a bit of a diverse group. So I'll try to address all the issues with that in mind. Next, I might mention, Sam, this is not working. Stand by just a moment, if you will here, David. I'll just use the arrows. Okay. So our presentation today is based on 4 premises. The first one is honesty is the best policy. Well, that's obvious. And your mother told every one of you when you're about 3 years old that honesty is the best policy. And I'm sure most people try to live by that. But the fact is, with honest, high integrity operations, there are no victims. And our goal is, if we've got a client who's been victimized, we want to find the perpetrators and figure out what we can do to get their misappropriated funds back in their planned account. And that's the bottom line of the whole thing. Because if there are perpetrators out there who have figured out ways to take advantage of others and to beat the system, they deserve to be caught and dealt with. And there's more and more of that going on now, as far as being able to ascertain what's happening within plans. And more plan sponsors are getting bolder and taking a close look at their plan and the details of it and the assets of it and the way administration is being done. So the second premise is that fraud, waste, and abuse are rampant in today's healthcare system. BCI estimates that the average self-insured healthcare plan has a fraud, waste, and abuse factor of 13%. Now, in our technical department, our headquarters in in Memphis, Tennessee, by the way, David, but our technical department is in Nashville. Then we also have a New York office. But I asked the top 3 people in our technical department to tell me, what do you think our averages are of what we ascertain is fraud, waste, and abuse in a self-insured healthcare plan? And I got those 3 answers and I averaged them out and it came out at 13%. Now, I'm going to show you some other figures today because it's all across the board. But the fact is, when there's inaccuracy in plan data administration, for some weird reason, David, it is never, ever in the favor of the patients in the plan.
Yeah, right.
It's always in the favor of providers, TPAs, and those other parties who are doing the administering. So that there's a message right there, we think.
But hey, Don, just before you jump to the next,
so premise number 2 is that it is rampant. It is a I'm sorry.
Oh no, I was just going to ask the question. So,
yeah,
waste out of those fraud, waste, and abuse. To me, my interpretation of waste would be not intentional, right?
That would be correct.
Okay.
But even if it's not intentional, if it happened and should not have happened, it needs to be corrected. And there's somebody there that made that initiated that inaccurate function.
Absolutely.
So that's what we find out: waste, fraud, and abuse.
Perfect. Okay.
All right. Premise number 3 is heightened awareness is really emerging now in a way that's helping a lot. So a couple of ideas for everybody to keep in mind. ERISA, which we all know was 1974, ERISA was enacted to take care of retirement and healthcare plans and create regulations to make sure that there's no wrongdoing. And anyone who is involved in HR or is in the C-suite of a corporation that's self-insured, the key people all are fiduciaries. And there's substantial fiduciary responsibility that goes along with that. And for a long time, a lot of people in the C-suite and in HR, they kind of stuck their head in the sand about ERISA and didn't pay much attention to it because nobody was really doing anything about it much anyway. But what has happened in the last 24 to 36 months is that there's a much brighter, larger spotlight being shined on ERISA compliance. And ERISA compliance, in the context of our discussion today regarding healthcare plans, means that the fiduciaries, on an annual basis, they need to make a proactive decision in a meeting with notes being taken on exactly who they're going to have as their TPA. A lot of people go year to year, same TPA, no meeting, no notes or anything. And then if and when the Department of Labor comes around for an audit of that company, they have no records, they end up in trouble and they end up getting fined. The average fine by the Department of Labor to a self-insured healthcare plan is $675,000. That's how serious this can get, and it can get serious real fast. So people need to pay attention to ERISA compliance, responsibilities, etc. One of the things that we do is we want to be part of the solution here rather than the problem, and we want to heighten people's awareness about that. Now, the Consolidated Appropriations Act of 2021 is a really big deal. And basically what it says is that it mandates transparency. It mandates immediate and prompt response when there are claims data requests by the plan sponsors of the TPA. So basically, there have been third-party administrators who for years have been sidestepping giving people the data they request. Well, they know that they and the providers will be vulnerable if they give all this data that's been requested. And of course, people want to do an audit. They got to have their data to do it. And we had a case 2 years ago prior to this act being put forth. And we had a TPA that jacked us around for a year and a half. They moved the goalposts. They said, well, you really need to be talking to so-and-so. And they turned us over to different people. And anyway, it was almost laughable how bad the situation got. And the bottom line was they had no intention of ever giving us any of the client's data. And even though the client owns the data and requested the data, no data was forthcoming. The Consolidated Appropriations Act of 2021 demands transparency and immediate response on data requests. No moving the goalposts, no jacking anybody around, no declining requests, because we don't send out that kind of information. The data is not owned by the TPA. The claims data is, of course, owned by the plan sponsor.
Yeah.
So that's a huge thing.
I'm sorry, Don. And as a byproduct, in the of late, there's been sort of a sub-market that's developed around audits, analyzation, breaking like pharmacy or insurance out of your plans for quotation, which really all stemmed around that Consolidated Appropriation Act. Then I'm assuming, right?
That's exactly right. There's a lot more going on, a lot more conversation about this entire space than ever before, and a lot of people are realizing it's time to take a look. We got one client right now that's got a $200 million a year healthcare spend. If our average statistic I showed you a few moments ago of 13%, that's $26 million a year of fraud, waste, and abuse. Well, we can identify that with great detail, as I intimated earlier, and we think most of the cases will be settled because TPAs don't want to litigate. They don't want the press, the PR that goes along with that. But what percentage of that we're able to recoup, of course, will be determined by the settlement, the negotiations process, and so forth. But if it's 60, 70% or what have you, it's still an enormous amount of money. And this is money which the plan deserves to have back in their coffers because it was taken from them inappropriately.
Yeah.
So the third bullet point down there is rising conversation levels among industry thought leaders. The more people who are talking about this and who are becoming proactive, the better, because that's the means and methodology by which they can no longer be taken advantage of. And that's getting another entity into the loop, like Benefits Claims Intelligence, to help them on this front. Premise number 4, I'll show in just a moment. When I say the game changer, this is the Consolidated Appropriations Act of 2021 shown here. David, I would encourage your participants in the program today to Google this act, and they can pull up the entire program. And it's rather voluminous, but it's very revealing about demanding transparency and, again, immediate response to claims data requests by the plan sponsor and so forth, and the mandating immediate response. Also, at the end of this, I'm going to be offering to send a number of documents and concepts to the people who might request them, and we'll send you we have a synopsis of this, just a page and a half that kind of hits some high points, but it'll give people at least an idea of what it's about. The fourth premise is knowledgeable healthcare leaders can introduce meaningful solutions. So it's about proactivity. And as we heighten people's awareness about this entire concept, let me give you an example of one thing. We have ERISA attorneys. They're not on staff, but we have them retained, and they're enormously bright people and specialists in ERISA, as I mentioned earlier. We put together a Q&A document with our legal team about what the rights are and what the recommendations are and so forth. For example, in the service agreement between a TPA and a plan sponsor, many times the TPA has absolutely ridiculous demands, like if you request data, we're only going to give you 15% of it. Well, that's absolutely unenforceable based on U.S. law. And they have so many other restrictions and guidelines that they designed, of course, to protect themselves, but they're not enforceable. So we've laid out some guidelines and things to keep in mind in taking a look at this situation within your own organization. For the brokers on the call today, this is all information you can bring to your clients and help them heighten their own awareness and deal with this in a manner that's going to serve them better. So those are all documents available. We're happy to send them to people. And again, they'll have that opportunity at the end of the PowerPoint here. So improved internal communications on fiduciary requirements and responsibilities. That's a key thing that you need to make sure you do. By the way, let me mention, David, that anything that anyone does that addresses ERISA requirements and fiduciary responsibilities, you need to make notes and, again, keep a file, because when the Department of Labor does come around, that information is going to be enormously valuable. It's going to prove your proactivity on this front. And that's what they're looking for. Enhanced checks and balances for improved accuracy and integrity in the administration of their plan, of course, is key. And again, the leaders, the people in the C-suites and the HR executives need to step forward, stand up, and do what they can to make sure they're not being taken advantage of. So here's a closer look at the waste, fraud, and abuse in 4 segments here. The Institute of Medicine conducted a study on waste in the U.S. healthcare system and concluded that $750 billion, or approximately 25% of all spending, is waste, fraud, or abuse. That's an enormous figure, much higher than our estimate, but it just tells you what some of the people are finding. In the next segment of that slide, it says the Coalition Against Insurance Fraud asserts that we lost $487 billion to fraud and human error in a single year, comprising about 1/5 of the total cost of healthcare. Then research suggests that only 5% or less of these losses are recovered annually. Well, you know, that's a travesty. We're talking about hundreds of millions of dollars that are getting sucked out of these plans unjustifiably. And what happens is not only is it depleting the monies in the plan, it's inducing all healthcare expenses for all the participants to go up considerably. And that's the ultimate insult, is everybody's paying more for healthcare than they should be.
Yeah, and that's then, considerable amounts of money, Don. Like, geez, that's $750 billion. That's
it's enormous.
There's countries that don't have a GDP of that. So
that's exactly right. It's enormous. In fact, I've got a little information here that says the latest year that was that the stats are available on is that healthcare spending grew 9.7% in 2020, reaching $4.1 trillion. And, you know, it's gone up from there. So these numbers are obviously enormous. So what is the employer's responsibility? Well, they're legally responsible to the Department of Labor, which, of course, oversees and enforces ERISA regulations and so forth. So employers have a fiduciary responsibility to choose the provider, and that's a proactive process which is done in a meeting with notes being taken on an annual basis, and a fiduciary responsibility to monitor the provider. Some of these TPAs have gotten so cozy with their clients that, frankly, none of this is ever even talked about, David. It's just a travesty. It just happens year after year. Now, here's an astounding statistic. When it comes to corporate board members, 78% of Fortune 1000 companies' board members are unaware that healthcare falls under ERISA regulations. Now, why is this so bad? Well, it's really bad from one standpoint in that every one of those board members is personally liable. That's their fiduciary responsibility. They are personally liable for any wrongdoing that takes place in a healthcare plan. They could go to prison if something is severely out of whack. And here, 78% of them don't even know that healthcare falls under ERISA regulations.
Wow.
So this is a gross overlooking of something that's critically important. I was talking to a CFO of a sizable corporation just actually it's been a couple of months ago. He said, Don, I'm not worried about my board members being protected. We've got a $15 million blanket insurance policy. And I said, well, you know, that sounds real good, but it's not going to keep your board members out of jail if there's significant wrongdoing. So he said, well, I hadn't thought about it like that. So, you know, I don't want to use scare tactics, David, but by the same token, this has been swept under the rug for too long. So again, we're on the side of the people who are shining the bright lights on some of these things that need to be dealt with.
Very cool.
So there are three key issues at stake. One, of course, is compliance and maintaining that compliance proactively on an annual basis under the regulations of ERISA. Waste, fraud, and abuse. And with BCI, you have tools to check the checkers. And when monitoring service providers, employers should act to ensure that everything that's done is agreed upon in services, including reviewing service providers' performance, reading reports they provide, checking annual fees charged, investigating practices such as third-party administrators' claims processing systems, ensuring proper maintenance of plan records, and following up on participant complaints. Now, these are items that are just proactively required on a routine basis. Some companies are good about doing these things. Frankly, the majority of the organizations are probably behind the curve in terms of what's expected of them by regulation and law. The third point at the bottom of this slide is asset recovery. And we have a process I'm going to go into in a minute, but the asset recovery, BCI will partner with you to recover funds that were improperly taken from you. So how does this recoupment happen? We work with the legal team of a self-insured client. We provide expert witnesses as needed, and we offer assistance to help them get this money back. We think that over time, 70 to 80% of these confrontations, if you will, would be settled. For the reasons mentioned earlier, TPAs don't want the PR and the publicity. And some, of course, will have to be litigated, which takes longer and costs everybody more money and everything. But those are the hazards of litigation. But we're prepared to help people go to the mat, get their money back. So a deep dive into the issue. Fiduciary duties are critical. We've talked about that a good bit. But on the left, according to industry estimates, the total dollar amount at issue nationwide could be as high as 1/3 of the total medical claim expenditures annually. Wow. Recovery initiatives, successful industry overpayment recoveries have reached into the trillions and involve many large carriers and many large corporations in the mix. So let me tell you what we're doing at BCI. The first thing we do is we have our Tier 1 product that's called a summary statement. Now, one of the questions we get asked first, David, is do you have access to our data in some manner, or do we have to get you the data? Well, we have a substantial nationwide data stack, and we have most companies' data. Sometimes we have to request additional data from a client, but we can do a summary statement in most cases with the data stack that we have that we've paid dearly for and have access to. So we do this summary statement, a picture of which is on the screen. That's a 3 or 4 page document, and that's what we call our shallow dive. But it's thorough enough that we'll look at 2 years of data, and we can tell an organization, self-insured company or municipality or union, we can tell them whether they got a problem or not. And we give them details, totals, and in this 3 or 4 page report. So that is free of charge to the client. That's noteworthy. This is something we do to it's kind of a door opener for us from a marketing point of view, but it's also an extremely valuable service because
I
a lot of
bet, yeah.
companies are flying along fat and happy and think everything's wonderful, and everything's not wonderful. And this will tell them if they've got a problem or not. If the problem is either non-existent or very minor, they think, okay, I guess we dodged that bullet. So that's fine and good. In most cases, it's going to show a substantial amount of fraud, waste, and abuse, many times to the figures that I mentioned earlier. And they're going to want to do something about that. Even though they might know and like their TPA, they might know and like a lot of their providers. But the fact is, if you've got money being stolen from you, you need to rectify that. You need to fix it. It's not fair. Honesty is the best policy, and you need to demand that you're being dealt with in a high character manner. So we think they should go after those monies that we've identified, and we'll help them do that. So tier one is our summary statement. This the cover sheet looks a little, or the cover sheet there of the summary statement looks a little bit like our tier two product, but this our tier two product is what we call our integrity report. This is between 30 and 40 pages. This is our deep dive. The summary statement we can generally produce in a week or less from the time we get the claims data. The integrity report generally takes 3 to 5 weeks, depending on the size of the organization and the number of claims we're dealing with. But this is our deep dive, and when we present the integrity report, it's got great detail, and it provides the information needed to be able to go after the monies. And we're very proud of what our capability is in producing this integrity report, and it's extraordinarily helpful to our clients, and it helps them in their process of recouping the monies that they're entitled to. Our tier three product is what we call a subscription service. And we want people to gain compliance and peace of mind, knowing that their plan is constantly protected from wrongdoing. So when we say this is ongoing, it's real-time plan monitoring. And it's put together with, actually it's per participant per month pricing, and recoupment services for misappropriated funds. There will be companies that we think will be in the subscription service for years to come. But 1 year, or it actually requires a 2-year commitment to engage in this. And this is extremely valuable because it enables people to see in real time what's going on. So those are our product offerings at BCI. So state of the industry, this is just in capsule form, some statistics, like 2.2 million companies are covered by ERISA plans, and 42% of all health plans are self-insured. 60 million total lives are covered under them. Assets held, 236 billion in those plans, and 91% of large employers are self-insured. So that gives you a little bit of information there on just some current statistics. The legal landscape gets real interesting. And I would like to suggest, David, some of your people might want to Google some of these, like these 3 cases right here. These are examples of things that are already in the books and finalized.
Well, I might even do better than that, Don. I might even find them myself and put a link to them.
Sure, or it's easy to Google them by those titles as well. But yeah, we can add that for the future. But there's Hilux versus Blue Cross Blue Shield, Cigna versus TrueVue Surgery Center, and the Saginaw Chippewa Tribe versus Blue Cross. These are all in the books, done, and substantial monies were paid by the TPA back to the clients. Clients will typically in this space go after the TPA, and then the TPAs would in turn go after providers who were in the mix of any questionable transactions and claims. But those are some cases, sometimes they can go on for years. The Hilux case up there went all the way to the Supreme Court, that threw it out back to the district court, but the TPA had to pay substantial funds to Hilux for fraudulently retaining funds without the client knowing about it for services and so forth that were not a part of their agreement. So these are just some of the examples of some things that have been done that offer some history of the space. Our solutions.
So just if
Yeah.
before you move on there, Don, just to try to help me out there.
Okay.
Yeah. So run me through it with your solution. You know, one of those cases that maybe you're familiar with. So how you would have fit in that process, and where you would have noticed it, stopped it.
All right. So the first thing we do is we engage with the management of a self-insured plan. We work primarily with corporations. We're starting to work with some municipalities as well. But what we do first of all is heighten their awareness about the possibility of fraud, waste, and abuse being in their plan. Much as I've shared it with you in this presentation today.
Right.
And they say, well, okay, yeah, we'll take a look at your summary statement. That's no cost, right? Correct. So we'll put together a summary statement for people, and by doing that, they'll know whether they have a problem or not. And in most cases, there is a problem, and they'll say, well, let's go to tier 2, and we'll invest in your integrity report. And for people who would request it, I'll be happy to send them our rate schedule of how we charge for our services and so forth. Again, the summary statement's no charge. Tier 2, there's an upfront admin and research fee, and then 25% of the recoupment comes back to BCI. And I'll give more details in the rate sheet that I'm happy to provide as well. So anyway, we get involved from the summary statement. Then they say, let's go to tier 2. Then we go to tier 2 and say a month later, we have them their integrity report back. And they say, okay, we're going after these monies. We have in-house attorneys and we have a law firm we deal with. We'll get them in the loop. And we say, great, we work closely with them in providing the data in such a manner that we're providing the proof of the wrongdoing. And we deal with the TPA. The goal is we'd like to settle it with the TPA. If it goes to litigation, again, we provide expert witnesses. We'll do what we need to do to get closure. And our whole goal is let's get our clients' money back. And we focus on that. And, hey, we'll be taken care of in the end. We get a percentage. But we're laser focused on what we got to do to get their money back. As to time frames, a settlement might be 3 to 5, 6 months to get that done. Litigation could take a year or more. That's a real wild card.
Mm-hmm.
But does that answer your question?
Yeah, totally. Yep.
Okay, good. All right. In terms of our solutions, we've developed supporting technology to strengthen and automate our processes while placing the client in control of their medical data. It's all HIPAA conformal. Advanced trending and metrics measure compliance. Deep analytics fueled by machine learning and artificial intelligence coupled with statistical analysis designed to find breakdown points in plan policy implementation, medical provider performance, network resource allocations, and more. And as to what that includes, these are some of the areas right here: duplicative payments, overbilling, code misuse, clinical accuracy, recouping through offset events, fraud, waste, and abuse trending and projections, and self-dealing. Got another slide that gives you numerical examples coming up here. Right here, we call this our BCI proof of concept. So we took a random 100,000 transaction sample from Blue Cross networks across the United States, and this is what we found for this 12 contiguous months of this data. First of all, I would call your attention on the far left. We've got the diagnosis categories by spend, and on the far right, you'll see the far right column is coding accuracy. These numbers should be in the high 90s, 98% or better. but they're not. I'll be frank in telling you, David, that we have a shareholder in BCI who's a physician who had a large medical practice, and he was bought out by a major hospital, and the executives in that hospital were calling him 2 or 3 times a week saying, "You're not doing enough upcoding. You got to upcode more," which means, of course, more revenue for the hospital.
Right.
But upcoding should be done with integrity, not with what you can get away with, but what actual services and diagnosis is being provided by the physician. So that's an example of what happens. So coding accuracy that's a pretty sad documentary on the medical profession right there. Billing accuracy right next to it in the next to last column is another item. Its accuracy is only at 93.35%. So, billing accuracy, that should also be in the high 90s. But again, for some weird reason, it's very rarely, and these errors are very rarely in the favor of the patient.
Yeah. Could you
These come out
imagine,
in
though,
favor
Don,
of the other entities.
take this to real life, right? So how many times have you been to the grocery store or something like that? And if 7 out of 100 items that you bought were priced wrong, you wouldn't even go to that store anymore, right?
That's right.
Yeah. That's crazy.
Yeah, but David, unfortunately, for a period of many years, people have been getting away with this, and it's become almost easy for them to do, and nobody's calling them on it, or at least they haven't been. But again, the spotlight is getting bigger and brighter every year that goes by, and we're helping to shine a light on it, as are other entities. And the Department of Labor has beefed up their audits that they're doing of companies, and they're more proactive than they've ever been. So there's more and more justification for taking a close look at this.
Very cool.
So billing accuracy and coding accuracy, that right there just shows that you're dealing with 7, 8, 9, 10% problems right there. So it's a sad situation. So our tier 1 is our summary statement, which again we do at no charge to the client. Tier 2 is our integrity report, which has a admin and research fee and 25% of monies recouped. And then our tier 3 basically is our subscription product with a 2-year minimum term. We've also just begun offering the auditing of pharmacy claims as well. So that's a whole new dimension for our business now. Benefits of engaging with us: heightened awareness of ERISA compliance and responsibilities, informing you of your plan's fraud, waste, and abuse factor from our summary statement, and gaining insight into who the perpetrators are. And that's all before you've cut a check to us. So that's our way of helping our clients get engaged in this process. And again, if they choose to go with our tier 2, that's where, of course, we end up being compensated and helping them recoup their monies. So anybody who'd like to have some of our free reports, we've got the Q&A with our legal team that is very informing. Our CEO is also an attorney, and he put together a document about phrases to be sure are included and excluded from your service agreement with your TPA. So that document's available, and the synopsis I mentioned of the Consolidated Appropriations Act, we can send that as well, and a few other items that tell them a little about BCI. So these are all available. You can email or give me a call. I'm personally handling all of these, and we'll be glad to hear from any of your viewers today.
Yeah, and so you work direct with employers, you work with brokers. Obviously, there's revenue channels for folks that are involved, and there is absolutely no reason why anybody or a broker should not be doing this for their end user.
Well, actually, this is a great service to brokers to enable them to serve their clients better. We totally protect brokers, and we have an organized broker network where there's broker compensation, and it's a whole new revenue stream for them. So they're not only being heroes to their clients, they're also gaining some compensation from it.
Perfect. What an eye opener, Don. I totally appreciate that. I'll go through and there's a couple things you mentioned. So if there's links to those, if you're reading an archive on the site or over social media, all the links should be provided below. And I'm thankful for your time. It was great hearing you speak. And now I know why you're a professional speaker. It was tough. It was tough getting in there to talk against you.
Well, thank you, David. I've enjoyed presenting for you today, and look forward to hearing from some of the brokers and the employers on this call, and be happy to be a resource any way we can.
Perfect. Thanks very much, Don.
You bet.